Hi, my name is Nidhi Sharma. I am a women's health physical therapist here at Funcphysio Physical Therapy. Today I'm answering one of the most common questions asked by me. If I'm leaking, do I need to do kegels? Are kegels good if you're leaking? So, to answer this question, we have to delve a little bit deeper into why you leak and what are kegels supposed to do. So, here is the pelvis. Okay, if we look inside, there is the bladder, and when we take these organs out, there is the pelvic floor. Okay, it looks like a big sling of a muscle inside. So what it basically does is when there is increased pressure on the bladder because you cough or sneeze or jump, the bladder gets squeezed a little. That pressure gets translated to the pelvic floor, at which point the pelvic floor should contract and fight the pressure coming from the top so that it can keep the urine in. If you're unable to do that, if you're unable to contract and fight the pressure, you can leak. So yes, when the pelvic floor is not functioning well, you need to make the function better, and that will help you in leaking. But sometimes muscle is weak, but more than that, it is tight. Okay, so I'm going to try to explain that with a different example so it's a little bit clearer. Okay, so let's say this is your bicep, right? And you're trying to lift 20 pounds. If you cannot lift 20 pounds, what will we do? We'll tell you you have to try to lift slowly 8 pounds a bunch of times, then 9 pounds, and over a period of time, you'll get enough strength in the biceps to lift 10 pounds. Yes, so you need strengthening. But what if your bicep cannot even straighten? What if your bicep is stuck in this position? Is so tight that it's keeping your arm here, so it cannot even go straight and then come back to lift 20 pounds or 10 pounds. This is often the situation with many women who are either overtrained to do the pelvic floor or who are always holding tension and keeping their pelvic floor tight. Because they're able to create that tension to keep the pelvic floor tight, they lose the ability to let the muscle relax, to let the muscle stretch. Every muscle in the body has two phases to it. It needs to be able to contract and be able to relax or stretch. Contractility and flexibility are both needed for the function of a muscle. So a lot of times women, especially women who are active, athletic, dancers, swimmers, very high intensity weightlifters, they sometimes don't have weakness of their pelvic floor, but they have tightness of their pelvic floor. And their pelvic floor already is holding like this, so it cannot do the function of lifting the bladder up, keeping it supported. And they try to add more kegels on top of it and get even tighter, sometimes making their leaking worse. So the answer to your question is no. All the time, leaking is not related to pelvic floor weakness. Sometimes leaking is related to pelvic floor tightness, or sometimes it is related to poor coordination of the pelvic floor. So you first need to get diagnosed why you're leaking. Okay, if you're leaking because you're weak, then yes, kegels and all things pelvic floor strengthening will help. But if you're leaking because of tightness, you need to do some flexibility work. You might need to get some internal work done to get flexibility in that muscle before you start to strengthen it. And if you try to strengthen it before that, your symptoms can get worse. Okay, so hopefully that answers your question. If you have leaking, go to a pelvic floor physical therapist and first get diagnosed, first get properly assessed to find out why you're leaking. Thank you.